I'm Mario Vaz, and what we thought we'd do today is to just have a conversation. This book by Kavery, A Luxury Called Health, actually touches on so many aspects. At one level, it is a personal narrative of a life spent in training in medicine and then in the practice of medicine in a rural area. But it goes beyond that, because interspersed in the narrative, Kavery takes us to the roots of medicine as she sees it. She keeps referring to the history of medicine. She refers to the educational system that she went through and experienced. She talks about healthcare in the country. And she talks about her experiences across a range of hospitals. There's a lot to discuss in this, but I'm afraid I'm going to start with something which I feel very excited about, and that is the history of medicine. Because for many years, when I was in St. John's, I curated a museum of the history of medicine. And the history of medicine doesn't really fit in to the medical curriculum anywhere. If at all a medical student gets anything out of medicine, it's out of the history of medicine, it's because they've come in contact with people who are passionate about it, or they have a personal interest. And like much of a history in schools, if at all they go through it, they learn about dates and people and very little about the context of how medicine evolved. Kavery in her book starts off with an introduction where she reaches back into the past and explains various systems of medicine that have evolved. And then in the later part of the book, she talks in a chapter called Ancestor Worship about the pioneers of surgery. And as I started reading it, I couldn't help but being drawn to the past, where, for me, one of the great events in the history of surgery, which was actually not performed by surgeons at all, but by barbers. And so the initial guild of surgeons were the Barber Surgeons, was a time when anesthesia was first, well, not first described, but certainly described under dramatic circumstances, where a man called Morton went to the Harvard Medical School, to the operation theater, and actually suggested that he had a means by which surgeons could conduct painless surgery. Now, this was something that no one believed. There were many people who came to that very same theater with the same claims. They attempted to demonstrate it, and they always failed. And then the whole audience, because in those days operation theaters were open amphitheaters, but quite similar to this hall, and everyone shouted, "Humbug, humbug." And so this man Morton comes along, he administers something to the patient, and Harvard's greatest surgeon, John Warren, operates on a lump in the neck, removes it, and afterwards asks the patient, "Did you feel anything?" And the patient says, "When are you going to get on with it?" And it was a dramatic moment. It was so dramatic that we are told that John Warren had tears streaming down his eyes, because he had operated his entire life with people being held down on that chair, with alcohol being poured down their throats to render them senseless. They had to work swiftly, but it was really surgery at its most primitive form, because they had to do it so fast. And this then was one major event. And history tells us that after that, from doing one operation a month, they started doing one major operation a day. So Kavery, it was unusual for me to see a doctor actually take this on and start talking about the history of medicine as a personal narrative. Where do you think the history of medicine fits in for yourself, first of all, in understanding your own field, and also in the education of medical students and of doctors?
For me, it is history itself is a subject I'm very fond of, and not as a subject, but something I like to live. I mean, try to retrace the time. It's something that fascinates me, through back to the past. And in medicine particularly, it was always fascinating for me. I won't say in medical college I thought much of history of medicine. Dr. Bhatia's wonderful lectures just went over my head. And because we were not really, I think, those days tuned in to history, and we were more tuned into our academic subjects. And since this was just an elective thing, just the one lecture a month, or maybe one in several months, so it didn't really have such an effect. It was only later, as I started studying surgery, and probably it was around the time I was training as a postgraduate, student. I was learning surgery and sitting in libraries where, after you have read enough of your academic stuff, you want to read something else, and then you go and read, pick up other books and you read surgery. So I feel, but I have kept a very personal touch with history. For me, people in history become alive in every sense of the word. And it's not just, and that is not only in surgery, but particularly in surgery, what used to happen is that, like when I read about people like Semmelweis or Bill Roth, Parry, William Harvey, so many of them who struggled so much and who had fascinatingly difficult lives. So I would start, when I started, I remember in my early days, and I wouldn't say early days, even much later, I would always invoke one of the surgeons as I scrubbed for surgery. That was the way I scrubbed, I would always invoke one of those people. And that became a habit. But that apart, that is my interest. But I think when we pick our way back through the years of history, not just medicine, I am not talking only of medicine, but actual history of our people, of India, of the world, I think we learn an enormous amount by going back, not only by going back, but reliving those moments socially, not just politically or just in a historic sense, but in a social and cultural sense. So history means a lot to me. And in medicine, for students, I regret the fact that we did not apply ourselves to history when we were students. I hope, it will change, and students will get back to that thing of connection with the past. Connection with the past is a very much an enabling thing for any professional, I feel. That think of not working only for here and now, not just thinking of, I am the surgeon, this is what it is, this is the modern, what do I learn next, what is the new thing? Not just that, but how did all this evolve? From where did I come? Just like it's very ironic that we are barber surgeons, we have inherited our gifts from the barbers, and right now in my sunset years of practice, my clinic is between two barbers, There's a barber shop here and a barber shop there. And they're two great friends of mine. And so sometimes I used to, like, Vijay would always laugh about it or tease me about it, like, are you going to borrow instruments from them? And I'd say, yeah, if you come as a patient. But what I mean is that the history is a very, very enabling and a very beautiful part of our medical life. Because medicine to me is one of the privileged professions. Privileged because every working hour of every day, you've got the chance to help somebody, overcome their suffering. It is an enormous thing, and it is not a burden as such. I think it's a gift, it's a privilege to be able to do it. And I carry that feeling, because of our ancestors.
Yeah. Thank you. I somehow also can't help but feel that a knowledge of the history of medicine for medical students and certainly practitioners as well is that perhaps it allows us to be humbled. Because sometimes we're so consumed by hubris, that we just think that we have so much at our disposal. And I often tell my own students that, a lifetime's work is often contained in a single sentence or a part of a sentence of a book. And in a way, it's tragic if we don't pay homage or at least acknowledge how truth has evolved over the years, because there's certainly a progression of truth as well. What we believe to be true today in biology may well be change over time. I know as a physiologist that what I learned as a medical student is not what I teach today. I want to take you back, Kavery, to your years of training, because there are several times in your book when you talk about your undergraduate training as well as your postgraduate training, where you, in a sense, describe the frenetic pace of accumulating knowledge, of just coming to grips with this vast body of knowledge which just keeps being dumped onto you. And over and above just knowing something is the pressure of acquiring the skills that you need to have as a competent practicing physician or surgeon. And you, at one point in time, you ask the question in the book, is there a better way? After having practiced for so long, do you think that there is a better way, or do you think there are at least different ways that we could approach education?
I think it is certainly one of the key factors in the if I can call it the creation of doctors or making of a doctor. In the making of a doctor, the formative years, particularly the first 2 or 3 years, but I think even right along till the final year, the undergraduate level, I think it is the key not only to what becomes of the doctor, but what becomes of our health system, because the doctors are only the part of a whole. I mean, what is the point in my writing about one individual life, my rather jagged, career, and talking about it? But I am only a part of a fraternity of, 6 lakh doctors in the country, whatever our number is. And I am only trying to say this is what we are, this is who we are. And there are a lot of sad things about us. There are a lot of things about doctors we are not proud of at this moment. And although there may be many things to feel happy about, many things that we have achieved and we feel good about, but I am increasingly, or I wouldn't say that, I think throughout I had this sense of anxiety and worry about what are we doing as doctors and how is it that we became, what we are. I think the medical education, as you started, you did say when you started off that we are so much into the academics, so much into proving our excellence, getting our awards and, being the best student and all that, that nobody seems to talk to us about the other things. The hidden curriculum, as you rightly put it, is how do we learn that simple fact of that person-to-person contact between the doctor and the patient, and it's not that as you go ahead and as you develop that you know all about it and you become a wise doctor. You don't. You repeatedly make mistakes. You repeatedly, find yourself being, not as polite as you should be maybe, or whatever that makes you feel bad later. But I think this thing of reflection for a doctor should have been taught to us. I mean, it should have been at least, we should have been guided into it. I learned probably to reflect because, one, I am I was always an introvert, of a certain type, and I tend to, be like that. But besides that, but through the medical college years, when we go along, and it's all about the exams, it's all about performance and how well we do. But when you suddenly come face to face with death, and suddenly come face to face with something so difficult, you see the suffering and the injustice of a lot of things, and that's when you feel so underconfident, of what can I do? I can't do a thing, except go on cutting and stitching and unblocking and doing all the things that we do as doctors and surgeons. We just do these mechanical jobs to relieve the body. But what have we really achieved? But that happens. Of course, we must continue to repair bodies. We must do the physical aspect. But to be good doctors, it has to be the whole system has to move forward or evolve towards a place where we are thinking not just of the 15% of the privileged class, but of everybody. And that sounds like a cliche, these days, because everybody says, oh, you talk about, this all the time. But no, it's not just talking, but about how do we make it happen? Like for me, this corporatized healthcare is in somewhat dicey business because although, the word corporate is all about the world of corporate world is all about making profits, while healthcare is about healing. Nobody ever talks of profit in healing, but now the two are linked. The two are linked and they work very well together. It looks like it. But, well, that's fine. But what happens if this corporatized healthcare begins to overtake more and more of our healthcare system, as is happening now? Who is going to worry about that? Who is going to address those issues? And why? How do we get the doctors in this? Doctors are always pointing to the government. Government is pointing to doctors. Both. The government, of course, has a huge responsibility in improving the social welfare and continuing it, strengthening it. But we are losing that. We are weakening the system. But in that, I feel we are hand in hand with the government. The medical system is hand in hand. Whatever is going wrong in the medical system is also our fault, because we are not standing up and protesting. We are not enabling this social thing to happen as it was at one time. When I was a young girl, when I was an intern even, my uncle had a heart attack and he was treated at the government hospital. I was in Mysore and I was an intern there, and he was in the ward in the government hospital. And that was fine. And his daughter later got appendicitis. She was operated there. But now, if any of my relatives fall sick with the same problems, there is no way they will go to a government hospital. It is not, there are so many problems, and that we are afraid to trust the government system, and also affordability is there, and there are these hospitals which attract, patients who have money. Now, how in the medical, at that time, when we were young, when we were students, we did talk about certain points like this, about who will go to the villages, who will work where, and only very, very few people had this sense of, a long-term vision. I didn't have long-term vision. I was just going along, performing, doing better, doing that. I knew I wanted to be a surgeon, but all that is fine. And in my early days itself, there was that feeling of, there was something bothering me about the way we were being taught. Although we had wonderful teachers, the teaching, the academic, and also the rapport that we had with our teachers was wonderful. But we also knew that we were an elite few. St. John's had 50 students per batch in my days. 50 students. So our rapport with our faculty was very good. And we learned a lot of things, not just by observing our teachers, about our conduct. We learned a lot from our teachers. And we went back to them and to meet them as well. So, but even so, seeing students from other places, doing my internship in a government hospital in Mysore, I realized that there was so much, that was not possible in a huge country like ours, unless, that is why I'm so strongly advocating, as you must have seen, that the Nationalised Health Service of England, some sort of a form of that is probably one way of being able to reach people. There are people who say, but our country is such a big country, how can that happen? The UK is a very small country. But health is a state subject. So if every state was really genuinely going to be involved in advancing social welfare, and the government was endorsing it, I'm sure we could make a better job of it. Because if we corporatize, that is going to happen. Otherwise, is corporatized healthcare with the high-end health insurance like it is in the US, that would be disaster for India.
Thanks, Kaveri. Actually, you've raised so many issues there that, I hope that there will be time during the question and answer session for people to also engage with you on that. It begs the question, of course, can doctors just be doctors and not be activists? Because we do, the medical profession does have a privileged position in society, and yet if we look at the major changes which have resulted in a fall of disease patterns even, it's really not because doctors have been proactive and have worked it, but it's because civil society has done so many things which have helped reduce disease. And for me, the example that clearly comes to mind is that of the fall in the mortality of tuberculosis, which was rampant in all cities everywhere in the world. And in Europe, we suddenly see, decades before the first drug was found, decades before the vaccine was found, we find a dramatic fall in tuberculosis. And it was because urban laws came into being. People started living better, nutritional status improved, so many things. And I think what you've raised is actually about the social responsibility of doctors. You also talked about the system of education, and you started talking about how you started learning how to be reflective about what you were doing, which wasn't something necessarily which students get in medical school. And right now, the medical curriculum has been changed. There's a National Medical Commission, which has created certain competencies which medical students have to acquire. And they've introduced a new module through medicine called ATCOM, which relates to attitudes, ethics, communication. And contrary to what we went through, what's happening now is that medical students are almost being forced to reflect. And I fear that's the other extreme, because you really can't reflect just because you're told to reflect, right? You need to reflect because, one, maybe you need to think about how to reflect, and you need to be taught how to reflect. So I see, just taking off from where you left, that I see a lot of students now busy writing reflective narratives or reflective essays, and they're not necessarily reflective. They're really reportage. I went to the hospital, I saw this, I did that. But reflection is something so much deeper. In what way do you think reflecting for you, while you were writing your book and writing your earlier books as well, helped you grow as a person and as a doctor?
Writing, because I started writing fairly, sometime soon after I became a surgeon. I was practicing surgery, but it was in the early years itself I started to write. And writing is, I think, also reading. Writers have to read, and they're always big readers. And through reading and through writing, we enter different worlds. We enter the world of different people. Just last week, someone very close to me came and told me that, was telling me, I think you should drop all this literature stuff, write only medical. See, your book is doing well. Now, just concentrate. Why are you writing stories and, all this? He hadn't read the book as yet, of course. He didn't know it was one big fat story. But what I mean is, reading and writing helps you to travel in your own mind. It helps you to understand yourself, that inner journey and the outer journey. Going to places where you, when I say to places, it's not necessarily physical distance, but the minds of other people. And when you create characters, if you are honest about creating characters, then you have to enter the minds of enter minds which are not yours at all, and develop the character's mentality, which is completely different, to what you might be. So that is a huge learning experience, and it is not neither easy nor difficult. It is there. So when you create characters, it has to be organic. You don't just say, okay, I'm writing a book on such and such a thing, this person, this. It's not like that. They grow, they grow like bit by bit. So that develops. I found, because everywhere in conferences, people ask me, oh, you're a doctor. So how does being a doctor influence your writing? And being a doctor does influence my writing, because I see all sorts of characters as patients and see all sorts of situations in life. So naturally, I get a lot rich material, and I understand certain things through my patients. But only once I was asked, some years back, how does your writing affect your medical career? In what way has your writing influenced, the act of writing influenced you as a doctor? And that, I think, is very important, because very important point. I hadn't thought of that particularly at all. But I think the writing has certainly influenced me in understanding people and understanding myself. So it's almost every writer is a person who's always developing and evolving, So that, which is very important, I feel, for almost everyone, to evolve, to not sort of be static as a person saying that, okay, this is what I believe in and that's what I'm going to believe in for the rest of my life. I may be wrong. I might say something today, I may be wrong. Have I got the courage to admit it 5 years from now that I was wrong? Or am I going to, stick to this? So changing our attitudes, changing our perception according to, if it is necessary, and being able to understand people who are just not like us. This is the biggest problem in the world today, that we are not able to understand that the other person is, when they suffer, they're suffering just like we would have suffered. But we don't want to think that when we have these narrow concepts, of whatever, I'm this and I'm that. We put ourselves in little holes, and then we don't know how to come out. And that can be very hard. So writing, I think, is very important and very, very helpful for a doctor. I might be doing the type of writing I do, but I think for any medical student, it would be very, very useful to do a lot of reading that is not necessarily about medicine, about everything, to know the world, to know the people, develop that love for reading, whatever it might be. And also, you can reflect without writing, but to write and reflect is actually, in some ways, it grows. It grows. So, that is, I think, a very important part for me, because this is my second career. 2 careers I have, writing and medicine. So I do think both, they influence each other. Yes, because it is the same person in the end, doing it. Yeah.
Just continuing off from what you mentioned about medical students should know a lot about the world in general and read widely. Well, in India, finally, we are seeing a movement which existed, which started several decades earlier in the West, where in medical schools, the humanities in health are beginning to make a major comeback. In part, I think it's because in India, we sort of moved away from the humanities. All those methods of inquiry which help us to better understand the human person. And that movement away, in a sense, for me, was prompted by the fact that we developed health universities. So everything became medical. Medical colleges were part of a health university. They were not a part of a plural university where you actually, in workshops, interacted with people who were completely in separate fields and yet could view a problem entirely through a different gaze and through a different lens. What I feel happened over the years is that medicine started basically growing within its own silo. And the humanities and health abroad has attempted to break that by getting people into medical school who are not necessarily doctors at all, but who are passionate about their own fields and who can help this broader inquiry for students. What do you think? I know that you have interacted with in St. John's with the humanities division, but where do you feel there is a role for that, and how can it be moved forward? Because I feel that there is, now when I see, it's become a popular word to use, and administrators keep saying humanities, humanities, but when it actually comes down to it, there's really not that understanding of how to embrace the subject, which I think should be embraced.
Yeah. For those of you who don't know, in St. John's, we have a Department of Humanities for medical students and for the faculty. And Dr. Mario was the chief, founding member of that, the founder. And it was a very difficult project to develop, to start, because most of the others, the medical the directors and so on, were not particularly interested because they felt that this was something not important. Because what was humanities? Humanities is learning about history, philosophy, literature, anything that touches human lives, outside of medicine. They could not understand why medical students needed to know these as well. But I don't know if you have met doctors who don't read at all or who don't do anything but medicine. Because it becomes such a narrow field. You go to the house of a doctor who does not read, who does not interact in any way, you will find no books. You will find, if you want to talk anything, you will be just only talking of medicine and maybe a little bit of what's in the news. Now, that's besides the point. What is the point is that for any professional, be it an engineer, a doctor, or any other profession, lawyer, I think you have to know the rest of the world. You have to know what happens. Why is it that the IITs, the IITs all over India have departments of humanities from the 60s? And they're very active departments with full-fledged faculty. So why can't medical colleges, which really are in need of humanities, why can't we develop them, and why can't we have better understanding of humanities and how to develop? My feeling is, to develop humanities, it is a learning process, exactly what you're doing in St. John's. It should develop, by actual on-the-field thinking and knowing the challenges. Because we found in the Department of Humanities that although there are so many interesting things we did, got outside speakers to come, speakers from all fields to talk to medical students, so many interesting projects, in art, music, history, lots and lots of things. Work for them to do, projects for them to do, but very few students are really interested. One is the interest and the other is the time factor, because they don't find enough, they're not given enough time to spare to come and attend humanities or do some projects. But I think that first of all, that passion, that keenness must be there for it, and it will only come slowly. I think humanities will evolve gradually. And because now there is a fairly active Department of Humanities in Nair Hospital, is it in BY? No? In KM Hospital in Bombay, which is good one. There are
and in Delhi.
Delhi, you told
UCMS,
me. Yeah.
Jharkhand
College recently started. So there are the departments for humanities are coming up. That means medical students can reach out, which will help them enormously. I mean, I can see the type of students who will go there. Not everybody wants to, but slowly it will pick up, and hopefully. But I think if you look at departments like this, even in the West, you will find that not all students will be interested. But we come back to the same question: what are we doctors for if we are not going to become all round? In our skills, our thinking, if we're going to narrow ourselves, we cannot help people.
Yeah. I'm going to shift to another area, Kavery, because you do mention it at several stages in your book, and this is about, the becoming a woman surgeon, okay? And of course, women coming into Western medicine itself has a very checkered history. We have the story of Margaret Buckley, who dressed as a man so that she could go through medical school, join the British Army, rose the ranks, died, and then a housekeeper goes to dress her body for the funeral and comes out screaming, if we are to believe the story, saying she's actually a woman. And but in the process, she showed that women could be part of a medical system. They could rise the ranks in a system where men were very dominant, and they could prove their competence. And then we have the story, so many stories of pioneers like that. And in India, too, we have Anandibai Joshi, who crosses the waters to join the Women's Medical College in Philadelphia, returns and tragically dies the first year that she returns, so she's unable to practice. We have Muthulakshmi Reddy in Madras. We have Kadambini Ganguly in Calcutta, so many pioneers. And of course, that has changed now, because if you actually look at the demographic profile of students who are joining medicine, you now see, I think, in most colleges, that the majority of students are actually women, because they actually do better in the qualifying exams, and there are actually more of them. And so the days when medical colleges had a quota for women in order to ensure equity have gone, because they realized having the quota was actually putting women down. They weren't able to get the seats that they needed to get on merit. But being a woman's surgeon is actually one step further, because in many fields of medicine, and the surgical fields perhaps are most demonstrate this most, is that there are areas where women are particularly underrepresented. And I use that word not to suggest that women have to be represented there, but they aren't just that many women surgeons. How did that, was this at all something that you thought about when you decided to become a surgeon? And how did it play out during your training and in your practice? You do mention it, some of this in your book.
Yeah. See, medical college days, I was a good student, okay, but I was particularly fond of surgery. And that was mainly because of my professor. There was a Professor Bansud, M.B. Bansud, who taught us surgery. And he was one of those who simply, who could make any subject seem simple. He knew how to make it simple. And I love that, the use of common sense in everything. So that was my first sort of developed a passion for surgery. I loved reading about surgery. I liked everything to do with it. I didn't particularly think I was going to be a surgeon, but it was one of my favorite subjects. And then I think it was sometime during my internship that I felt, again, working with a lot of very good surgeons, government hospitals, although we think, in many negative aspects about them, have some of the finest doctors, finest surgeons and physicians. They have very good doctors, and there are some who even to this day do enormously good work and run the departments really well. So I worked under a few very good surgeons, and that was when I sort of began to develop this interest, thinking, why can't I become a surgeon? And but then the minute I mentioned it to my father, there was, a lot of opposition. I mean, first of all, doing medicine itself was a risky business those days, to put your daughter to medical school, but then to become a surgeon. So he spoke to the surgeon, the professor, saying, please dissuade her from this foolish idea. So when I was talked to, about it, I felt very bad, I felt very furious that people should be telling me. And it only made me more stubborn, maybe. But I didn't know how to go about it, what to do to become a surgeon. I knew you had to get a postgraduate seat, but how, because everybody seemed to be against my doing it. But then I wrote to Professor Bansod asking about it, what did he think? That because I wanted to. And he said, yeah, if you really want to do it, go ahead. And he gave me a lot of encouragement. And he was the one who, helped sponsor me to go to Liverpool. Because he somehow had that faith that I would perform well. He felt that. And that was a great, thing for me. Although I didn't think anybody would agree, so I never showed the letter to anybody for quite a while, 2 months or something. And then when I showed it to my father, he was happy. And he said, okay, go ahead, you've got a good opportunity. So that's where I started. But even during my training in England, I used to have periods of doubt where I felt, what have I done? What am I doing? All these men, and they so, I don't know, daring and brave and dashing about and doing things. Here I am, hobbling around, standing in the background, all this, and really not at all confident. I was not confident. And I was regretting in a way and thinking, how can I now quit almost, that type of situation. I was almost in that position. But I, of course, passed my part 1 FRCS and I was going to do the second part and everything. And then when it was okay, after I got a registrar's post, and there I was taken as a registrar, that was when, and I thought I had done, it was wonderful that I had been selected, for this university job, because there were very few jobs and there were a lot of, white people and men who were competing, and I had got it. But then it was after the interview that one of the interviewers came and told me that you didn't do very well in your interview, and I was shocked. And I thought, my gosh. And he said, what is the use of sitting there and just giving yes, no answers? You're very timid. You didn't project yourself, because he knew me if he had seen my work, he knew me, in the interview board. But he said, nobody else knows you. And if you just sit there saying yes and no and, not doing it, you have to come forward. You have to show what you're capable of. That confidence you have to build. So I felt terrible and I was very angry with him, sort of all that. But, I mean, in my mind, I felt terrible. But over the weeks, I thought about it. And then I realized that it was my fault, that I was staying back. I was not moving forward like the others. And then I learned to change, that thing of how to go forward and be more confident, go along with the others, ask for opportunities to do work, to do cases, that type of thing. I learned to do that. But I all along I didn't face much of gendered discrimination myself. I didn't, except in that funny sense when, you're working in a rural hospital and patient doesn't know you're the surgeon, he'll be calling the ward boy, call the surgeon, and he thinks, so ward boy is the surgeon, I am the nurse, So they don't think a woman could be the surgeon. And but later they became comfortable with the fact that I was a surgeon. So rural area, I overcame the difficulties much quicker than when I went to a city. When I worked in Madras for a short while, for about a year, it was very difficult because from the managing director of the hospital down, everybody wanted me to only see women patients. So it was only women patients for me, So I was quite offended because I was used to seeing everything. I'm a general surgeon, so I do all types of surgeries. So why am I only being told women? And what they meant by women was on very few simple things, breast lumps, and there were few things restricted for general surgery. So you're dealing with the women, but they didn't allow you to, didn't want you to do anything else. So that was when I really, faced the true, and I found that was why most of the women were gynecologists, because gynecology was open to women. So these are things, but I did meet a very fine woman general surgeon in England, Avril Mansfield, who was a professor at University of London for a long time. And so from her, I learned that you can be a good surgeon. You can be a woman, you can be in the middle of men, but you can still be good. So there are all sorts of careers. It's only not just medicine, but there are so many careers where we take it for granted. We are conditioned to think these are male jobs and we do not do them. Just like nursing is considered a female job. But I think it is necessary to break boundaries, not just for the sake of breaking it, but because it gives to a holistic meaning to that particular specialty. Because surgeons, I think women surgeons can bring in a lot more into the act of being a surgeon. And we can learn from each other, just like we learn a lot of bravado and so many things from the men. Similarly, they can learn so many things from us. So I think that these barriers over the years, I hope will, reduce. And I say that not for the sake of proving a point that a woman has to do this and do that. I don't mean that. Only when the inclination is there and when the capability is there to give it full freedom.
So Kavery, you then became a surgeon with an FRCS, and then you decided to return to India. And I would imagine that the more attractive thing would have been to work in a city or in a large hospital, and but you actually went out to work in a rural area, and as you tell us in your book, you went out to Bihar, and you do mention, in a sense, why you did it. But I didn't actually feel that you dwelt on that very much. You do talk a lot about what you did there, what were the challenges, and how you had to, in a sense, negotiate so many aspects of being a surgeon in small hospitals where there were clearly challenges because of their size, because of their administration. So what actually drove you to a rural area when there would have clearly been opportunities for you in cities?
Yeah, I was all set to actually join St. John's Medical College on one time in the beginning, but I went there because a friend of mine was there, one of the nuns. It was a Catholic mission hospital, and she said, we have a real shortage we have no surgeon, no, they had one surgeon, but it was very, very hard. Will you come and work for us for a short time? And that's how I went. But what I found, having worked in rural area, first in Bihar and then in Uttar Pradesh, in Brindavan, Mathura, for 6 years I worked there, and 2.5 years in Bihar. What I found is that that was early on in my career. What I found is that the type of unpredictability of the challenges that you face. We always face challenges, but the unpredictability of those challenges, you don't know what you're going to face next. And that is a scary thing in the beginning. And one of the things it makes you do is, one, keep learning, teaching yourself and learning from others, like maybe getting in touch. Those days we didn't have online, but getting in touch with your colleagues who are working elsewhere. There is one of my teachers here, Dr. Norman Guido, who taught me some plastic surgery. I came here much later, to learn from him, because it was to help me for my rural work. But using different whatever ways you can find of learning more and becoming broad-based. I love the idea, because rural surgery gives you so many challenges you're not going to be able to tackle. The type of things I have done in rural areas, I would not dream of being able to do in a city, and but I had to learn them myself, most of them. I had not seen such cases. I had to learn. So you have to, you have to know your orthopedics, your gynae, your genitourinary, urology, everything. You have to know so many things in order to work in a rural area. Plus, you must know your medicine, because if you don't know your medicine, you'll probably operate on the wrong patient at the wrong time. So you've got to learn these things. And at the same time, you must know your limitations. It's not just you think, oh, I know everything I take on because there's nobody else here. No, it is knowing your limitations, that this is how much is possible here under these circumstances and my expertise. But beyond that, where do I send? So all this must be worked out to be successful in a rural area. And I found that whole thing, that whole act, like we did in Mokama, where we had a very good system. The nuns ran a very good hospital, an effective operating room where the tribal girls were trained as operating theatre staff, who were all not even school passed, and they were very, very good. And the nursing staff, most of them who came from Kerala, they started a nursing school there, which is still one of the best, I would say. It was a very, very good nursing school. And we had a few other junior doctors, but it was easy to develop your skills there. It was easy to form teams and to be able to deal with difficult cases. So that in a way, I would say it became my specialty. Rural surgery became my specialty. That I said, okay, I must do this, whatever I've chosen, I must do this well. Because if I go to a city, there are hundreds of general surgeons. There are any number of professors, there are all, it's there. And so also in England, the opportunities were there, plenty. But I did not feel, the excitement of rural work is something else. And it's not just the excitement. Excitement comes with a lot of hard work, and you curse quite often, why the hell am I having to get up at 2 in the morning and all this. But the people, the communication that you can have with the community, the type of rapport you can develop with people of all strata, it is a fascinating life experience, I would say, So rural surgery was in no way for me a self-denial or, sacrifice or something I did. Nothing like that. I enjoyed it. And it gave me enough comforts as much as I would need, So I'm really grateful for that experience, the fact that I could work in rural areas. And I feel that because, in India we have, I don't know when we have to open for, we have an association of the rural surgeons of India. And that was started in 1992. I think, 1992. And I heard of it only in 1997, and I joined it. And we have, there are over 1,000 surgeons working in all different parts of the country. And we have annual conferences where we exchange ideas and innovative methods of doing surgery and so much else, how to keep a rural hospital sustainable. We discuss so many things. And plus, we do not take sponsorships from pharmaceuticals or, take advantage of these things. So I feel attending such conferences would be a great help for young doctors working anywhere, because doing rural surgery is not that you have to always be a rural surgeon. You can, if you want, go elsewhere. But it is certainly as fulfilling as any other area. Yeah.
Thanks, Kavery.
And I also want to mention that the mission hospitals in India, which are somehow on the decline. On the decline meaning not really on the decline, but the fact that corporatized hospitals have taken over and people, those hospitals find it difficult to sustain themselves, which is such a sad thing. But I wish the mission hospitals had instead kept on their own path and not tried to be competing with the corporate hospitals. In the cities, probably they would have survived, even elsewhere.
Thanks, Kavery. I enjoyed talking to you, but I think that I'd like to open it now to people here. There are many aspects in the book which I've not talked about, we've not talked about. And so if any of you all would like to ask Kavery, yeah, please.
And I'm going to start at the very basic with the word doctor itself. And whatever I have learned, a doctor is more of a teacher. You all spoke about learning, education, and all of that. Why is that doctors are not giving it back in terms of teaching and encouraging people with the knowledge that they have gathered? Because I think we are giving away the space, or rather the doctors are giving away their space to non-doctors, if I may call it. And they are probably doing that. That's part number one. That I would see, sir, you touched upon being activist. But I believe if more doctors could teach more, or in whatever way it's possible. That's point number one. And where do you see the art of medicine, the love, the compassion coming into healing as part of this? Thank you.
Okay, I'll start, and I think maybe Kavery can add to that. I absolutely agree with you. I think that over a period of time, doctors as a profession, we have abrogated that role of interacting with communities and talking with them and teaching, as you mentioned, as a result of which there is this infodemic of all sorts of information. And I think most medical doctors will be asked at some point in time on their WhatsApp, is this true? I think, well, for me, I think a large part of that is trying to revisit how we train medical students. I think that while we focus on the training of medical students, I think we do have to actually emphasize the role that doctors have in communicating with society at large. Regarding the issue of compassion and so everyone wants a competent doctor. So let us take that as a given, that you do want competence. Compassion without competence is not going to work, but you want competence and compassion. And that's part of why the whole flow of the humanities and health in medical schools has started coming about as a movement, because there is a recognition that somehow we've relegated these things like compassion, communication, all that, as something that's soft, and that the real things of being a doctor is the technical expertise. So we become so biomedical in our approach that we actually fail to place medicine in the context of society. And I think people who are coming out and are in medical schools are themselves becoming aware that we are failing at some point in time. So there are movements which are trying to address this. I hope they succeed. That's all I can say. Do you want to add anything?
I'm reading from the internet. It says how doctors responded to being named a leading killer. What was the medical community's reaction to being named the third leading cause of death in the United States? So here's my question. I've grown up in India, spent most of my life in India. I look at the cops. They don't look like role models to me at all. They can't run after a thief, let alone catch somebody else. I have been to quite a few hospitals in the last 2 months, taking my mother all around, right from a psychologist all the way to a couple of neurologists and stuff. I don't see doctors in good health themselves. Where are the role models?
As good role models.
I
understood. I understood what he said. Yeah, you're right. You're right. And that's one of the things we are talking about all through this thing. And how do we make doctors not just good role models, but good doctors? And the same with teachers. I mean, it is again, it is up to the doctors to take it on, And all these three come together. The art of surgery or art of medicine is something that is difficult to teach. The science is what is taught. The technical knowledge, everything is science. But the art of it comes, I think, mainly with observation of other doctors performing and from experience. For instance, you may get two surgeons who are equally skilled, but one may turn out to be much, much better in the end. The outcome for the patients may be much better than from the other one, but their skill may be equal. It depends on their ability to judge, the judgment of when to do what. A surgeon doesn't always cut open people. Every patient doesn't need to be cut up. So how does the surgeon decide whether she opens the patient or does not open the patient, to talk about a simple case. But these things have to be learned. If a doctor does not know this, because I have seen wonderful surgeons who stand at the bedside where there is a decision to be made, but they cannot decide. They will either postpone it or they'll refer it or they'll do something. They will be they are not able to decide. That dithering goes on. Now, this is the most difficult thing. Art evolves, art in surgery and in medicine, the same thing in medicine. Whenever we have a challenging case, whether it's in medicine or elsewhere, we have multiple choices, on how we treat the patient. So how do you decide? And the art of medicine is what finally helps you in this. And I am sorry to say that I don't have a proper answer for role model for a doctor, but I think it is something every doctor must also think about, especially the most senior among us, but everybody. Why?
So I'd only like to say that we do fail as role models when it even comes to being role models for health. So if there is that famous saying, physician, heal thyself. And there is a lot of failing on that side. And we have also failed ourselves as a profession because as a profession, we are expected to self-regulate ourselves. And I think it's fair to say that there is a lot that is wrong with the medical profession. And there are many reasons for that. But we are a profession. We have a council which is supposed to be responsive to the rot that exists within it. And there will be rot in every profession, but certainly unacceptable in medicine, where patients come into a hospital and expect something of their doctors, which they have every right to expect. I think that's something that there's a lot of thinking about it. There's a lot of uphill tasks in relation to that. I don't have a simple answer, I'm afraid. I don't know if there are many doctors here. I don't know whether you all would like to add to that.
No, because I think it's a psychosomatic. People will come and tell their problems. We knew the families. We knew their financial this thing. And people, I know, they will go to specialists and ask. If I said no, they won't take the medicine. That much faith was there. But nowadays, family physicians are not available because all new medical students want to specialize because there is a money. And corporate doctor, even if I got money, I can't be free with him. You want your time with me. So I think something you can do so that family physician system can come back. Patient can talk with you freely. Because I know them, they were very free with me. There are many family physicians were there. Now I think only 10% remained. Because we are all crossed our age and we are all retiring. So anything if you can do. Thank you.
I think, Dr. Thelma, will you be able to say something about this?
Yeah.
Please. You recently gave an interview with The Lancet talking about so many problems, but about this, what doctor has just now said, about the dearth of family physicians, is that through Sochara, through which you are advising doctors. They run a foundation, Sochara, which is very much involved in guiding young doctors in the right direction. And they've done incredible work. But I would like Thelma, because they both have, Dr. Ravi and Thelma have a world of experience in this. So if you could just, tell us, because this is something that worries all of us, the dearth of family physicians.
I think it's an extremely important point, because we are also at this moment actually looking to how, India can reach universal health care in the next 10 years. I mean, we've been trying to do this in 75 years since our independence, and it's high time we actually reached our goal. Being a scientific profession, being, as you were saying, the health system also needs to be, in a way, repaired, healed, and made less rotten, And in that, I personally feel that family physicians and family medicine, even as a specialty, requires much more emphasis in both policy planning as well as practice. There are some institutions which have family medicine programs. They are much more widespread, like the general practitioner program in the UK, where they actually undergo very extensive training. Doctors undergo very extensive training after the MBBS to be a general practitioner. As Kavery was, vividly telling us about the exciting challenges of being a rural surgeon. So family practice, general medicine or general practice is actually very challenging, very exciting, but it requires a lot of training. So a few institutions have started this. This needs to be mainstreamed. It can't just be the 2 or 3 good institutions which are doing it, because our population of 1.3 billion, needs this. And rural India is still actually, there's a huge divide. The inequity in India's healthcare and in access to care is really bad for all of us, and it's also very unethical, So I think going back to medical education that was being talked about and the formation of teachers, this doesn't get the necessary focus. I mean, the focus tends to be on, on the specializations and on the subject, each discipline, which itself is challenging. I mean, and it's also enticing for the young students. So I think now I know St. John's has developed a department of family medicine. It's in its early days. But as it grows, and it depends on the priority that's given by the management, and not only of a institution, but more broadly, But I guess if there is more strong pressure from the public, I think sometimes our public can also be more vocal and more articulate. If there is a stronger voice, and so the Lancet Citizens Commission that Kavery was just mentioning is actually called the Citizens Commission because you're trying to get citizen voice into the process of, planning and, in a way shaping or forming the health system as we move forward. And if that is more citizen-centered, and as people are also getting much more informed than they were in the past, and are much more very capable of giving good suggestions, but then how do we listen to them? How do we take that forward? So I think medical education itself will have to go through further change. We can't keep increasing the course. The youngsters at 17, 18, they were actually extremely young when they joined. Maybe it should be after the a basic graduation course as they do elsewhere. So people are a little bit more mature when we enter, and then we don't get into all the trouble some of us did. But, so I think this holistic approach, whether it's family medicine, I basically come from community health. I mean, there are different fields that need to go. Thank you.
But I also wanted to add that the citizens' role, as people, as patients, all of us become patients one day, or relatives of patients, our own responsibility towards what happens to healthcare in our country. I think we are too passive. As people, we are too passive. We are not asking questions. I rarely find patients who ask me questions about their illness, In fact, I have to prod them that why don't you ask me questions? Why did I get blood pressure? Why did I get diabetes? Why do I have such and such a problem? If you're going to do surgery, what exactly are you going to do? So I can draw and show them. I mean, I make it a point to do all these things. I mean, I have all these things scribbled all over on my desk. But I keep drawing things to explain to patients. But patients must take responsibility for their own health. I think this over dependence on the medical system is also really a sad thing. You know, the body is where we are living. We have only one body in a lifetime, you know, and we have to look after it because that's where we exist. And to hand over this whole responsibility to doctors in payment of money, you know, the whole idea is a little unsound. And of course we need doctors, we need care, every one of us. But I think to take some responsibility, what can I do to control my diabetes, or what can I do for my arthritis besides the medicines you give me? What changes can I make in what I eat or do, whatever? You know, that type of individual responsibility. Also, as and when, I think all of us are capable of it, of voicing our dissatisfaction, not only dissatisfaction, but concern about what is happening to healthcare. Are we going to allow the government to reduce the healthcare budget year after year? Are we going to allow them to do that? Which is what is happening. In spite of the pandemic, the healthcare budget has not increased, and nor has the education budget for education. Now, why are we as the citizens not being more vocal about these things? That is a big concern for me. I feel doctors and the citizens have to work together if we are going to rescue health. As I made, a lofty title we gave to the talk, but you know, in the end, it boils down to a combined responsibility.
Talking from the point of view of a patient, there are not all doctors who will explain to you the whole course of your disease, your choices. They will just say, do what I tell you to do. They will not take you beyond the next step. Suppose you undergo surgery, you should have physiotherapy. It's also the role of the patient is very important in cooperation, but all doctors are not the same. That has been my experience. So both the role of the patient is very important to cooperate, but many doctors will just say, do as I say. And that attitude has to change.
I agree with you fully. I agree with you, and I constantly try to make patients ask questions. Yes. Yes. Yes, you're right. Yeah. Yes, yes.
First of all, I haven't read this book yet, and I really look forward to reading about it, because this discussion the two of you have had is very rare. It's an all-embracing kind of role of the doctor, the mindset of a doctor, and not just the academic skills which everyone else talks about. And because of the pandemic recently, anyone and everyone thinks they know something about a disease. Many quote the internet for many things, and everyone thinks of specialists as the people to go to. But I'm so happy to hear two of my colleagues over here talking about the role of the family physician. And actually, India was famous for that. You had a family physician in every community who you could trust. And I belong to an organization, a central government organization, where I worked for a little under 40 years, which was conceived of as a family physician looking after the central government employees, CGHS. Unfortunately, due to the demands of people for specialists, people don't take the advice of the very well-trained UPSC-selected doctors who are in their posts, and they just want a reference to corporate hospitals. That aside, I also feel now, this is from the organization point of view, it may not be relevant to everybody, but I just want to express that the family physician for whom the organization was supposed to be the bedrock of raising the health of a community failed because everyone wants to go to a specialist. Now, if we are talking about cities, what about the rural? You have worked as a surgeon, and now you're actually practicing more as a physician in a rural area. you will be the right person to say that. Of course, Kodagu is a very advanced community. They are very well educated compared to the rest of rural India. But everyone expects that after an education, or maybe they say after a government seat, doctors should go to the rural areas. Now, do they know the reality of working in a rural setup? Not always there is electricity, there is not guarantee of safety, of housing, of so many things that we take for granted, and to blame doctors for doing that. In my feeling is that if they try to make things like this compulsory for doctors to go to rural areas, I think they should make it a team. Send an engineer, send civil engineers, send economists, send arts, humanities people as a team, send them as a team, and the DC of that area will assist them to develop the whole community. Along with that, you would have infrastructure development as projects which can be done by engineering graduates who can put their actual skills to work instead of working only in software countries, software companies. So this is my feeling. I would like to know in Kodagu whether you think postings in rural areas for doctors to be made compulsory is the way forward to bring rescuing of health. Because you need doctors. I feel very, very sad that the people at large in the country don't have access to healthcare. And we say PHC has to be within 8 kilometers. How can a person leave their job and go to a PHC where a doctor may or may not be present, the medicines may or may not be available, and to get succor? It's a long just observation, but I thought it went in the scheme of rescuing health. Thank you.
Thank you, Doctor. I think that's a very good suggestion that if you're sending doctors to rural areas, first of all, ensure that they've got good housing, safety, school amenities. Everything should be looked after, or their stay in the rural area should be comfortable, and not stressful. And also the idea of sending other people like engineers and teachers and economists and everyone to rural areas to have a sort of a team go. I think if a project like that was started by the government in a streamlined way, that would make a lot of difference. Yeah, surely.
I'd just like to add briefly to that. I'm fortunate that I went to a medical school where there is a rural service scheme, and students, after they graduate, go for and work in a rural area for 2 years. I was fortunate that I worked with one of Kavery's classmates who's completed 50 years in a rural area as a doctor and as a surgeon working for leprosy patients. I think there is a point in saying that if you make it compulsory, well, are you going to even get the commitment of the doctors who finally go there? But I think we've not been creative about this whole thing, even in medical schools, trying to match doctors to where they might see their future progression. So there are rural hospitals, for instance, who need eye doctors. And if a student wanted to be an eye surgeon, well, why not go to a hospital which can actually use those services or has a doctor already in place? And I think I speak for a lot of students who have actually done this, that the vast majority of them, when they come back, whether they went there reluctantly, whether they went there not quite knowing what they wanted to do, or whether they went there completely committed to doing something, I think almost universally, a lot of them, I shouldn't say universally and a lot of them, but a lot of them come back saying that it was perhaps one of their most formative experiences of their life, regardless of what happened later on, what they did with their lives later on.
Thank you. I read your book recently. I found it very interesting. One thing you talk about is your great concern about blood transfusion and problems with lack of access to blood banks in rural areas. Could you explain what you think would be the best path to fixing this problem?
Currently, the best way, I mean, I have talked about a lot of problems in the last couple of decades, you know, when we used to give direct unbanked blood, which was safe. If you have followed the proper WHO requirements for safe blood transfusion. But having said that, right now with the policies in place, the best way would be to have proper blood banks, at least like in a district, one in each taluk, you know, one for each, like a block, big block of villages. And if you have one place where there is a blood bank, then it can service, you know, ensure that the whole place is it has the facility to get blood. In a place like where I work, Kodagu district, we have one blood bank. We had one blood bank for a number of years now. We have two, and it is still quite difficult to ensure blood because you need to, running a blood bank in a rural area is a very difficult thing because you have to have electricity all the time. You need it to be manned by proper staff who are ensuring, you know, the right, and most of the equipment needs air conditioning. So there is a lot of investment and lots of expense, and how many rural hospitals can afford this is the point. So if they are government-based health, you know, if government sets up these blood banks, you know, which are efficient, well-running, and are quickly able to cater to the needs of the surrounding hospitals, I think that would be the best thing to do now, because the government has point-blank refused to accept the concept of unbanked direct blood transfusion.
Good evening, sir. Good evening, ma'am. Little intimidating because all my teachers and seniors are here. But just to sort of bring out the perspective and like what Dr. Thelma and Dr. Mario touched upon is to really understand what a young doctor in the country is going through today in terms of medical education. I don't know how many of you saw the Netflix series called Quota Factory, which talks about churning out, and I have to use the word churning out for entrance exams. It's unfortunately sad that medical education is heading the same way, because if you look at everything, and even with the next exam which is coming to replace NEET, coaching institutes are looking at trying to focus medical students' education on postgraduate entrance exam. The focus is no longer on trying to become a good doctor or have different experiences. It's just either on USMLE or on trying to clear the entrance exam. So with this sort of a background, it's becoming tough to go out and have the experiences that a doctor should be having as such. Even the ones who are in the rural areas are always under stress, because we have a WhatsApp group where we try to support them with their clinical doubts and all. The focus is always on, how am I going to clear my exams? I'm wasting my 2 years here, so I'm going to get a seat only after 4 years, and that's really going to hamper my life. So what can be done in the medical education system which actually incentivizes doctors to become complete and have this experience? And just a brief second point, not sure how much of the general public and how much doctors are here. There is a lot of disenchantment coming in the medical fraternity, particularly the younger ones, because it's the world of social media. And we see that when the farmers' strike happens, there's a huge national protest and a national support. When the CA bill happens, when a Zomato guy gets slapped, there is a support. But when anyone is subjected to doctor violence, there is no support from the general public. You literally have the statistics out there with regard to the posts and keywords that it really doesn't trend, as they say, or it doesn't become viral. Last year, 65,000 doctors in the country were left with their future hanging in balance without exams taking place for 1 year due to various reasons. And not a single member of the general public raised the issue as to why this was happening, why were there Supreme Court delays and all that. So it's also time, as people talk about doctor-patient communication or a doctor-patient support, to also look at empathy towards doctors and the current situation and work together. I think the whole aspect I hope this brings about is to ensure a closer collaboration between the community being sensitive to the needs of the young doctor and the young doctor being sensitive to the needs of the community.
Thank you, Doctor. That was very well put and very important point you raised, you know, and it's something for all of us to think about. Thank you.
Good evening, sir, ma'am. I come from a college, medical college, that I did my community training in a college in Vellore, a reputed college in Vellore, where we did, one of the things we used to do is we used to bring MBBS students into the community and make them stay for almost a month and make them understand what are the other aspects of health, how it gets influenced, and how disease develops as such. So I have two things. One thing, what I observed was the younger generation, they're more of a privileged group at present. It's not like previously. And they don't find it that, okay, this is what I need to know more. And that's what my personal take was. And it was very difficult as a PG trainee to explain to them that, okay, this has a bigger role and you shouldn't be catering to a particular section of the society. So the MBBS students, like as he said, who gets into the medical colleges are ones who are already privileged to go to centers where there is a system where they get trained and into that system, and those are the ones, the cream layer that comes into the top. I am very sad to say that if a person studies in a government school in their own medium, the chances of them getting into the elite medical college system is very less. And even if you, like what NMC is trying to do, we will push them into the village. Even if you try to force them, nothing's going to change. Unless you allow a student who is coming from a really backward community, he would contribute back to his community. Nobody from a city is going to go to a forest area, a tribal area, and then, okay, today I'm going to work. It's impossible. Unless the person comes from that same community, he feels a sense of gratitude. Yes, I have to come back. At present, I'm a consultant working for a mission hospital in North Bangalore, and I train family medicine physicians. What I feel is there is a big gap. One, as you said, there's a decline in mission hospital, not in the quality, but because of the income generation over the COVID pandemic. I had tried to get into mission hospital, but what I understood was everything was getting into decline because of the revenue. So if you want something to the public medical system, the government, the public-private partnerships, the investment has to be more, and it should not be focused more on profits. So what happens, as you said, like the corporatization of, when there's a competition between corporatization and the mission and vision, it just gets diluted. And I feel that that's not the right way. And if anything, any change has to happen, I feel that it has to start from the education system changing drastically. Otherwise, as you said, I don't think there's going to be any rescue in health. So thank you.
Thank you. Thank you so much, Doctor.
Thank you. A bit of a repetition of one of the points brought up by the speaker before this gentleman. I'm very concerned with the violence that we've read about against doctors when something goes wrong with a patient. And I haven't read much about a prominent association like the IMA or any other subsidiary association making concerted efforts to call upon the citizenry to come together with the doctors to create awareness as to what exactly the status of a citizen is, or a patient or the patient's relatives is, when something goes wrong. And how much of it was really, like you said, the citizens have to look after their health also. So you neglect yourself totally, come at the last minute to some kind of a salvation, and it doesn't happen. So is there any movement from the Association of Doctors to call upon prominent citizens or citizen bodies to start creating an awareness so we can reduce this danger to doctors? I think that's a very concerning aspect of our society today.
Well, I don't know. I know that there have been a lot of attempts by various associations to try and raise this issue. I think it is a complex issue because, on the one hand, I feel that citizens need to stand up for what they believe is integral to their own well-being, which is a good health system. And so, if there is violence against doctors, that doesn't serve that purpose. I think, on the other hand, maybe the medical profession has to recapture the trust of the public, and maybe that would also help address that. But I think we've also moved to a very transactional state in a lot of our dealings with each other. And that has, unfortunately, I think, influenced the way people react to a lot of problems. And so maybe that's one of the reasons why people don't respond to violence to doctors. And doctors have every reason to feel aggrieved because in a lot of these situations, it's not to say doctors are blameless, but there's a lot of situations where the doctors are really at that point where they are conveying bad news, which unfortunately is a part of the practice of medicine. I'd just like to thank Kavery for this evening. It was a pleasure for me to talk to you, Kavery, and also to all of you all for bringing up your questions, discussing the issues that you had in your minds. It is a huge issue. Health and its rescue is something which will take some time, and I think it really needs the efforts of everyone. And I hope that is something that will happen in the future. So thank you very much for being here this evening.
And I want to also thank all of you for being here and participating so actively in this session. And I hope you've heard enough to think about. I have heard a lot that I must go back and think about. And I also want to thank Bangalore International Center for making it possible for us to hold this event and events like this. Thank you.